With Dr. Rebecca Berry. She's a clinical psychologist at the Department of Child and Adolescent Psychiatry here at NYU. All right, what should parents know about how social media is impacting their children that they don't already see?
Right. I think, there's a lot that happens on a screen that parents may not be aware, because many of our youth are reporting increased usage. I mean, the numbers are quite phenomenal, and that could be for adults as well. But it's important for parents to really understand about how much time their child is really on their device and how they're engaging with social media, what programs they're on. So when we think about some of the impacts that the time and the way that youth are engaging on their growing minds, we really can see a profound increase in anxiety, depression, low self-esteem, and for some, a reduction in their body image and some distortion in their body image as well. That's been a prevalence that we've seen growing as well.
Our colleague Sanjay Gupta wrote a great piece this weekend and has a great episode of his podcast about this, because he has teenage girls. And he wrote this essay on CNN.com, and he says, it's so important to start having the conversation with your kids, but how do you start the conversation? Take a look at what he wrote. He said that conversation means sitting down unhurried, undistracted, and having an in-depth discussion with them, your kids, without scolding, without judgment. I did that with each of my girls and learned a lot. Try to discover how and how often they use their screens, which social media platforms they're on, what to expect to get from their interactions, and those interactions, how do they make them feel? So thoughtful.
That's really wonderful advice. And I would really add on to that in addition to understanding what platforms they're on and how they're using social media, but maybe see if you can go a little bit deeper into how is social media functioning for these youth? Meaning, are they already feeling some loneliness, isolation, low self-esteem, anxiety, and depression? And social media could be serving as a way to placate or to cope with those feelings pre-existing. Right? So can you figure out, are there other things happening that this may be functioning for, right? Social media may be using for.
We talk a lot about, what we do and how we're watched by children. It's on us too, right? I mean, we're all a little addicted as well.
Right. It's important, when possible, for parents and caregivers to really model how they would like their children to utilize social media and how often they are really kind of, stuck with their screen. And I think that the report that we saw really mentioned having some, phone-free times or phone-free zones within the household, such as the kitchen table, or let's say a living room, where you can really encourage open conversation, eye contact, and connection. It's not always easy because we are in a very busy time. Everyone has so many things to do, and we're always constantly connected for some reason. And perhaps it's worth us really taking a look at how we're investing our time and really utilizing this medium.
Dr. Rebecca Berry, thank you so much for coming on and explaining all that.
Appreciate it.